from the surgeons to the hospitalists, nurses, all the way to case management. So I thought, I think I could be a part of this team. So I decided to pursue medical school. And I can keep you here all night. So just to kind of give you the greatest hits on the next couple of years, I didn't have all the prereqs, so I enrolled at UCO, where I eventually earned another bachelor's in biology, biomedical sciences. Graduated from there, applied, did not get in. I applied straight through, didn't get in. So I got a job at OU Health Sciences Center in the Department of Geriatric Medicine as a research assistant. I did that for 2 years, fell in love with research there, and it was kind of that newfound love that encouraged me to apply under the dual degree program at OSU as a DOMS. I was waitlisted and then accepted, and went through that program, the expedited master's for a year, and then started medical school, and now I'm second year. So that's how I got here.
Excellent. Marvin, do you mind jumping on?
Yeah, no problem. Sorry about earlier. There's a little technical difficulties. So my name is Marvin Carr. I'm a second year medical student as well as Jordan here at OSU. So my journey is a bit different as well. Originally, I'm from Chicago. I went to Elmhurst College, which was about 45 minutes outside of northwest of Chicago. Played football there, majored in exercise science, and to be honest with you all, medicine, as far as medical school, wasn't really on my radar. I kind of wanted to go into physical therapy, shadowed a couple PTs, kind of saw that it was really just too monotonous. I thought it was a little mundane for me to just do day-to-day ins and outs of life. And so that kind of transitioned me into shadowing a PA, and going and shadowing a PA, I really figured out that wasn't a route for me either. But before I knew that, I had went on, and after I graduated school, to get my EMT, and I got my EMT. I was really, kind of in awe about emergency medicine and everything that it provides, and working the team aspect and setting stuff like that. And so there was one night on our rotations for our EMT training where we're at Northwest Memorial Hospital, downtown Chicago. And, you look at the board in the hospital, all you see is GSW all the way down, and, all gunshot wounds coming in. And I just remember there was one patient came in, the attending, she's standing at the head of the bed, and it's like, 50 million people in the room, And I remember just watching her in that moment with a bunch of chaos going on when they're doing a thoracotomy, they're intubating, all these other things and distractions that are going on. And she is just poised, calm, and collective throughout this whole moment, right? And she knew everyone's role, what everyone should be doing. She had kind of great command of the room, and it really just reminded me of being in a setting of when I played football, of working as a team, right? Being a leader, being cool, calm, and collective under what people would consider tough situations, right? High stress environments. And so from that point on, I was like, hey, okay, what do I have to do, to get where you're at? Because I really just gravitated to that very, very, very much so. And so that kind of led me to pursuing medicine. From that summer, my wife and I, we moved here to Tulsa, Oklahoma. My wife was a part of Teach for America. And so that's how I transitioned here. And so worked as a surgical assistant at St. John for a little bit, had some great experience with a bunch of DOs there, kind of really mentored me and groomed me and took me under their wing. And lo and behold, I was able to get into the bridge program here at OSU, and I've been grateful for it ever since.
Excellent. Dr. Bailey, do you mind weighing in for us?
Good morning or good afternoon. So my journey here, at least to medical school, was traditional in the sense that I, graduated high school and then matriculated on Prairie View A&M University, where I was a part of the Prairie View's undergraduate medical academy. Basically, in short, what that is a program held in or co-sponsored by Texas A&M University, where they provide mentorship, research opportunities, as well as shadowing experiences to undergraduate students interested in various healthcare professions, but particularly medical school. They also provide test prep scholarships and things like that. So through that program, I got exposed, as well as through other Prairie View alumni who were actually attending OSU. I was exposed and kind of learned about what it took to get to medical school, and then also what OSU was about, and that really kind of spurred me to apply. So I ended up getting into the class of 2000, graduating class of 2011, and from there I graduated in 2011, and that's where my journey kind of took a different route, where I went on to the military, served as a general medical officer, and then came back to do or finish my emergency medicine residency. So mine was a little circuitous on the back end as opposed to the front, but I'm here nonetheless. So
Thank you, sir. I appreciate your service. Dr. Kurosawa, do you mind weighing in next?
You're muted.
Okay, sorry about that. Thank you. I said my path to medical school is pretty unique because I didn't do medical school here in the United States. I'm from Nigeria, and my medical school was done in Nigeria. I'm sure before some of you were born or so. And in Africa, in Nigeria in particular, the biggest problem to medical school is financial. And we don't have scholarships, we don't have all this luxury that is affordable, that is present here in the United States. So family support is the most important thing. And unfortunately, I'm from a very poor family. But all my family came together to support me through my medical school. And then to get into the medical school, my ambition was initially to be a pilot. I don't know why, I was small then. But fortunately or unfortunately, I couldn't be one. I was on the track to that, but I happened to be an AS, hemoglobin AS. So that knocked me off that route. Then I focused on my medical school. Financial struggle is the biggest problem, and there's no government assistance. Government can only assist those whose parents are rich or whose parents are politicians who are corrupt. So unfortunately, I wasn't in that route. So my parents, especially my dad, sometimes I think and say to myself, may you rest in peace and thank you, Dad. There was a day I was just in the medical school. He brings money for feeding, money for tuition, and one day there was no money coming. And I waited the whole day, nothing. And I decided to go home to find out what's going on. And behold, the only black and white TV that we have in the house, my daddy sold it just because he wants to raise money for me to go to medical school or pay my school fees. So it's rough. But thank God I excel. My excellence in medical school, in high school, really pushed me forward such that the negative poverty, corruption, and all those things, I don't feel it that much because I was so focused, and my excellence just pushed me. There's so much tribalism, so much, bribing to get into what you want to be. But medical school was about 7 years for me, and I finished medical school. I practiced back home in Nigeria for 6 years before an American family decided to bring me over here. And then that was how I got to the United States, 1993. I graduated from medical school 1986. So when I got here, it's a different story. Remember, I've already done 7 years medical school. I've already practiced 6 years, and I got back to the United States. I have to start all over again to be able to get into a residency program. So I have to study, pass the USMLE, then got into our most famous Black neighborhood residency program at Harlem Hospital in New York, under the umbrella of Columbia Presbyterian Hospital. So I was there for 6 years, and I was really exposed to what Black physicians do. And I think we're going to get into that down the line. So that's my story for now. Thank you.
And Dr. Thomas, you want to bring it home for us on this question?
Okay, good afternoon. My path was also a little bit unusual because it started with my grandmother, actually. She was a nurse, and this was back in the 50s, 60s. And she had this idea or vision that if her daughter had a son, that he should be a doctor. And so as I was growing up during my, toddler years, and the question was asked, Mike, what do you want to be when you grow up? The only answer I could say was a doctor, and nothing else was accepted. So I went through that through elementary school and junior high, high school. And then I got to a point where I realized, well, the only reason I'm saying this is because my parents and my grandmother have pretty much laid this in my lap to pursue. And I really didn't know much about, the ins and outs of medicine, particularly with training and getting into medical school. So when I was a freshman in college, I got, the easiest job that I could qualify for to get into a hospital, and that was a nurse tech. So this was in the 80s, and back then, you gave pre-op enemas before urology cases. I emptied urinals and changed beds and all that stuff. But I'm in a teaching university. I'm at the University of Arkansas, so I'm seeing medical students, and there was a fair amount of diversity during that time. So there were males, Black women, Hispanic, just a variety. So I was able to appreciate that, and then meet some physicians along the way who were faculty at the university. And so I did that for a while, decided to go to respiratory therapy school. So I did that and was a respiratory therapist for 11 years, went to medical school and worked during that whole time. And then developed a passion for surgery, and went to University of Kansas in Wichita, did the 5 years there. And then I've been here in Tulsa since 2006 with OSU-CHS. So I'm very, very pleased to be a part of the organization.
Excellent. Thank you, gentlemen. Specifically at OSU-CHS, in terms of the pathway, the Black student population is at a historical high, with 31 students in the bridge through fourth year classes. This particular group also follows an interesting trend, as 28 out of the 31 students currently enrolled are considered non-traditional, and most bring multiple post-baccalaureate degrees, and many have utilized programs like the Bridge program and dual degree to get acceptance into OSU-CHS. So jumping right into our next question, the Black Men in White Coats documentary, which I encourage each of you to watch by emailing Brenda Davidson and our DEI office to get your access code. This film uses the quote, "You can't be what you can't see." And to our panelists, in terms of visibility, when did you meet your first Black physician that influenced you to pursue the path you're currently on? And Dr. Thomas, do you mind weighing in on this one first?
Sure. Well, as I had mentioned, there were Black physicians at the University of Arkansas in residency, family medicine, cardiology. We had an attending neonatologist there as well. And then on the research side, we had a Dr. Rayford, is a doctor of physiology for the university. So I would say 18, 19 is when I was able to, have that opportunity to view that perspective. And not only those physicians, but actually the medical students under them that were rotating through different services.
Awesome. Dr. Kurosawa, when did you meet your first physician?
Again, very unique. When I was growing up, as early as 10 years old, I met the village doctor. He's like a middle-aged guy who lives in the village where I grew up. And everybody look up to him to heal you. He's more like a god. So one day I was sick and my mom took me to his clinic, which is just a small rankled office. And he saw me and he said, "Did you go to that stream?" I said, "Yes, we swim in that stream." He said, "Oh, you've gotten something from that stream. Make sure you don't go through that stream anymore." And of course, I got something. And since then, I looked up to him with a lot of respect. And like we always say, I always ask him, "I want to be like you when I grow up." And he's very compassionate, well-loved in the village. Everybody knows him. And there's nothing as fulfilling in the kind of job he does, and the village loves him. So I try to put myself in that shoes, and I say, okay, I'm gonna go through that path. And once in a while, I go to the clinic, sit down with him, do some of his paperwork in terms of fold envelopes and do things like that. And I got a good rapport with him. And unfortunately, by the time I really left to the big city, I lost touch with him. And I think by now I heard that he was late, Mrs. Smith, so rest in peace. So that's the first time I met a Black physician. But remember, I trained in Nigeria. Everybody is Black, and very few Indians, but little or no whites. Most of the whites are expatriates, and they live in the posh area where poor people like us can't even get there. So most of my interactions are almost with Black physicians.
Thank you, sir. Dr. Bailey, when did you meet your first Black physician?
Well, met my first Black physician when I was 18 years old, when I was in college, actually. Again, through some of our, mentorship programs, some of the alumni from Prairie View came back to speak with us. So I got an opportunity to interact with them. And then also a classmate of mine in my undergraduate class, her father was the primary care physician on campus. So, I got a chance to interact with him as well. So, but before that, whether I knew it or not, at least to my knowledge, my first 18 was the age that I met my first Black physician. So, and that's, surprising growing up in a diverse area like Dallas. But, I was never sick. So I guess I never really had a reason to go to see the doctor. So.
Thank you, sir. Jordan, do you mind weighing in on this one?
Yeah, sure. So I like how you added a little modifier on there. That influenced us to go to medicine. Because my first interaction with a Black physician was probably the first hand that touched me on this earth. My dad's a physician, and I was delivered by his partner, who's a Black physician. They're both OBs. So that was my first, quote unquote contact, I guess you could say. But, really growing up, I always looked at him as dad. He wasn't Dr. Dad, he was dad. He just had a job. He worked in medicine, whatever that meant. So that wasn't really a huge influence for me. I wasn't like Dr. Thomas, where there were whispers of, you're going to be a doctor, this is your path. I didn't get any of that really. And so the first person probably that I encountered that I realized that's going to be me, I'll be in those shoes, was probably when I met Dr. Pasha, which was a year ago. And, that was the first time that I heard someone talk that was kind of close enough to me, but also far enough away to realize like I could see myself in him. And so that was, I guess, you know, I'm non-traditional, so I'm 30 now. So I was 29 when I really was influenced, and medicine took kind of a deeper grasp on me, you know. And so I can elaborate, but I don't want to take up all the time.
Thanks, Jordan. Marvin, do you mind weighing on this?
Sure. So my pediatrician growing up was a black man, maybe around the age of 10 to 14 years old. But even then, it was kind of, I had to go across town to see him, right? And so, but other than that, I was kind of echo what Jordan was saying earlier, I didn't see another black physician until I started working at St. John, and that was Dr. Pasha as well, in terms of just seeing someone that looks like you and just really being able to identify that, saying like, hey, like it's achievable, you know, it's attainable. So.
Excellent, thank you. And I know, Nick, you had told us that Dr. Baker Hankton was one of the first ones you had met. So we're going to jump right into our next question. In medicine, there's a saying that when you hear hoofbeats, you normally think of horses rather than zebras because common things are common. Well, from 2019 to 2021, Black patients were fairly common, making up 1 out of every 4 ER visits, while these patients had a 0% chance of seeing a Black physician. With OSU Medical Center being the closest hospital to North Tulsa, with zip codes with an 11-year life expectancy deficit, I have this question for our panelists. What impact would more Black physicians have on the city of Tulsa and the state of Oklahoma? And if you don't mind, Marvin, I'll have you weigh in on this first, being from a place like Cook County, Chicago, which is infamous for addressing disparities. And just please share your thoughts on this topic.
Yeah, I think there's a lot of ways, you know, that you can kind of go about answering this question. For me, I would say one of the biggest things that stands out would be just debunking myths within the Black community. And so we know the hesitation within vaccinations and the Black community, and either all these other oddball interventions that we try to do with healthcare. I think a lot of that can be, you know, kind of solidified in terms of having our presence within that community and just educating the community on, you know, what these medications really are, what these health interventions really are. I think also, Chris, you mentioned about, you know, the health gap that we see between North and South Tulsa zip codes being, you know, 10 to 12 years in terms of, you know, the death gap. I think having more Black physicians within our community, it decreases that. Again, going back to education on, you know, here's what a plant-based diet looks like, and just also normalizing overall health. You know, like typically you don't see Black people cycling, right? And so like something like that within our own community, you don't typically see like Black people swimming in the YMCA. And so, you know, having those things, like just those little things, other people kind of draw into that just because they see someone else doing it. And so it could be something as simple as me going into a restaurant and ordering a plant-based meal and someone saying, hey, you're not eating any meat or anything or any dairy. So can you tell me more about that or why you do that? And so just those simple conversations with people, you know, that inclines them more to want more, to want to hear more about it. I think also, you know, we had a class a while back and one of our professors mentioned that on average, a physician brings in about $1 million to whatever community or hospital organization that they're serving. And so when you talk about these disparities within the community, a lot of them really kind of boil down to money at the end of the day. And so if you're able to strategically plan that out where you have these physicians working within the same area, bringing all this income in the same area, may increase revenue within these areas. And now you can build more grocery stores. Now you can build more healthcare centers, and just eliminate all of these disparities that, you know, keep coming up over and over and over.
Excellent, thank you. Dr. Kulasaba, being from a place where the physician in town took such an important role as a community representative, and then seeing how that uplifted the community as a whole, in addition to just being an expert on infectious disease, Do you mind weighing in on this topic as well? You're muted.
That tells you I've not done this frequently, right? We know 13% of American populations are Black. Only 2% of American doctors are Black. Think about that. So there's a lot of healthcare discrepancies in the US Black neighborhood. Black people have the lowest life expectancy, especially the Black males. They have increased heart conditions, they have increased weight, increased diabetes. And most recently, the COVID crisis. The COVID crisis showed us that more Black people die. So this is not acceptable. So an increase in Black doctors will definitely impact this kind of results. It will improve the healthcare discrepancies, especially in Tulsa, to decrease the Black mortality. It will improve primary care access, just like improve multiple medical comorbidities that we have among the Black people who don't usually have good primary care access. And it will provide a better, perspectives in medicine as a whole. Just like he said, the previous speaker, vaccination, so much social media crap about vaccination. And sometimes I see my Black patients and they believe in it. But if more Black doctors are there, I've been able to convince some of them. And they say, okay, Dr. O, I will go with whatever you say, So race is an issue. If you have a Black doctor-patient relationship, that will reduce some of those misconceptions that they have. So the more Black doctor, the more Black patients, the better the outcome in terms of the life expectancy and their multiple comorbidities. And also to improve compliance. During my practice, I've seen so many occasions where, if I run into a Black patient, it's like they would take a big relief. Oh, finally, a Black doctor is seeing me. Thank God it's like that. So, and we talk, they feel more comfortable, they are so impressed. So the more of us, the more we have, I'm sure it's going to make more impact in the patient-doctor's relationship. If not, there are so many other little things that we can improve on. Go to the Black neighborhood more frequently, show up ourselves. We just need to take baby steps and it will add up. Otherwise, the Black people will continue to receive unsatisfactory care, and especially in the preventative medical care that we have. So, thank you.
Thank you, sir. And Marvin, I appreciate you bringing up that data because it was actually released by the American Medical Association, which can be found in the chat, which I'll post here in a second. Each physician brings a value of over $1.9 million into a community and supports over 12 jobs. And this is specifically to Oklahoma. OSU-CHS has put out around 106 Black physicians into communities over the past 52 years. This averages out to 2 Black students per class. Unfortunately, less than 15% of those physicians were from Tulsa, specifically places like North Tulsa. As our panelists may note of, imagine what we could do for our city and our state with more intentional recruiting efforts and to make physicians for Tulsa that are from Tulsa. That same logic also applies to historical Black towns like Muskogee, Langston, Boley. However, systemic problems require systematic solutions. The documentary also makes the statement that more Black males applied to medical school in 1978 than in 2014. So for my panelists, in this context, what barriers exist that are preventing more Black males from becoming physicians? And Nick, as our first Langston alumni in over half a decade, Do you mind addressing this question first?
Definitely. I think a major barrier that's present is definitely the lack of mentorship. I believe the documentary's opening quote goes as, "Oh, what an impact a great mentor can have." And that quote could not be any more true. The pre-med journey and the application cycle can be is a very challenging processes to traverse. And it's definitely riddled with lots of intricacies and things that students need to know and need to do in order to set themselves up for success. And I believe that providing mentors to Black males who are interested in medicine could really help give them the advice and the guidance and assistance that they need, but also the encouragement to see the process through to the end.
Excellent. And Dr. Bailey, as a Prairie View alumni and being from Texas, which outnumbers the amount of alumni we have from Langston, do you mind weighing in on this as well?
I definitely agree with Nick. I mean, to kind of add to his points, it's a lot of information out there. We live in the information age where, Google is at your fingertips from your phone, et cetera. So I think that, knowing where to look and having someone, where this mentorship comes into play, having someone to kind of focus you in the right direction. You still have to put in the work, but having someone to kind of point you in the right direction is very, very key to kind of navigating this process, and then so, with the outreach programs, whether it be high school, college level, I think that's, all these things kind of are important, in showing prospective students, prospective, future physicians, kind of the pathway to getting into medical school and beyond, which is, you mentioned the Prairie View thing, the Prairie View kind of anomaly, I would say, because Prairie View, for people who don't know, is about 30 minutes outside of Houston. And, at one point in time, starting with Dr. LaToya Smith, we had, I would say, 8 people enrolled at OSU-CHS and spread out between 5 different classes. And we actually had 9 altogether within a maybe 5 or 6 year period. Again, which is, this is a school that's, in Texas. So, I think a lot of our recruitment to OSU-CHS came organically through people coming back to Prairie View and just spreading the word about how good of a school this was and is. So, I think that same, thought or that same thing could be replicated at places like Langston. I mean, Langston is in the state. So there should be, a lot more students coming out of there. And I think that, opening up those lines of communication both ways, whether it be a group going to Langston and vice versa, a group coming here to OSU would be good to kind of, establish that mentee relationship and, really help serve as a bridge to getting into medical school. So.
Excellent. Thank you, sir. So from the different panelists that we've had and from some of the response that you've not only given some of the problems, you've also listed some of the solutions. And so with that laid out on the table, I would like to know just from all of you, how can we as an institution and collection of individuals address these barriers and create a pathway for more Black physicians? And Dr. Thomas, do you mind leading us off with some of your solutions?
I think OSU-CHS has already taken the first step by establishing, an Office of Diversity to, look at this and focus on it and work with physicians within CHS and beyond to develop a pathway to engage young people in the community, to be more visible. The fact that we're having this forum and panel discussion, to my knowledge, I've been here 15 years at CHS, and I don't know that we've had something like this before. I know we've had SNMA and things like that, but actually going back into the community, engaging high schools, colleges, various forms. I think we're off to a good start just with the establishment of this department, and Brenda is doing a very nice job.
Thank you, sir. And student Dr. Jackson, do you mind weighing in on this next?
Yeah, of course. So I think a consequence of where we are, the makeup of the state, is that Black isn't the default. For us on this panel it is, and for a lot of other members of our community it is, but on a wide scale, Black is not the default. And for that reason, we can't use default recruitment tactics and default mentorship tactics, because we're going to miss people, because that's not what the default looks for. And so, I think our school does a great job with, our mission is to train rural physicians. And so what do? We go out and get them. I was part of Operation Orange 2 summers ago. We were out in Enid. We go rural and we get them and bring them here, train them, and then they want to go back to their community for the most part. And so I think if we just adjust some of those resources, we have an underserved community down the street that we haven't reached out to. Just a number of examples. Last year, we went to Central High. Tommy organized that, where we gave a presentation to some of their students on all the options in medicine, and not even medicine, just healthcare, that you could do. And they hadn't even heard of some of these professions. And we organized that. That's something we did. Marvin and I went to crossover prep last semester. We were invited. We sat in their assembly, through their prayer service, and then after had a 2-on-2 meeting with the principal and their pastor on how we could build a relationship with this preparatory school. Now that's a all Black male middle school, high school preparatory school, and that's what we did. We went there. The same day that the Zoom got hacked for the first showing of the documentary, Marvin and I organized a meeting at ORU with their Minority Pre-Health Association. We had a couple people in person, about 8, but about 20 or 30 on the call for a recruitment event. That's something that we did. And so you have students who care and who are going out and getting these people. We're going outside of the default path to find these people. And that's something that I think we can continue and blow up on a larger scale, because we have the resources as a school. We just can't use the traditional tactics to get these students that look like us to this school, because we'll miss people. There's no reason we should have had 15 or 20 Knicks, and there's no reason why he should be the first one in half a decade from Langston. So I think that's something that we can work better towards in the future. Now, I'm not saying what we have now is wrong. I'm saying it can be better. What else do we have to lose? We can only get better.
Thank you, each of you. So we're gonna shift directions now and allow you to incorporate some more of your answers into some of the questions that the crowd has asked. So as I read this question to you, I just want you guys to, I'll go in order to see who wants it, and then we can go from there. So from the crowd it appears more African-American females are being admitted into the US medical schools. Is it because Black men are not applying, or admission decisions are not in their favor? What could be done to improve the number of Black men joining medical schools? Dr. Bailey or Marvin, do you guys have any opinion on this matter?
So I'll share this. In terms of the admission process, I can't really speak on behalf of every medical school and what their numbers look like in terms of applications of Black men versus Black women. What I will say is there's an African proverb that says, what you do for me, you also do to me. And so in terms of what we're talking about of increasing the number of Black men in medicine, I'll give you all a little context of what that proverb means. And so several years ago, investors wanted to put another Dollar General here in North Tulsa. And the community members of North Tulsa, they didn't want another Dollar General. I believe there was already 2 to 3 Dollar Generals in that neighborhood. And for you all that don't know, North Tulsa is considered a food desert. And so what the community members wanted was a grocery store, not some $1 mom and pop shop. And so these investors they didn't take any input from the community on, the decisions that were being made. Ultimately, you fast forward to here we are in 2021, after talking with, city councils and city aldermen, they were able to get investors to build an oasis or the fresh market that's about to be open here pretty soon here at North Peoria. And so I say all that to say that it's easy to kind of what Jordan was saying too. It's easy to say that Black is the default. I think too often we lump some minorities into one group, right? And it's not so much of one solution is going to fit each and every group in the minority realm. And so, the Latinx community has different needs than the Native American community does. The LGBT plus community has different needs than what even women in medicine may need. And so in terms of increasing that number, I believe that there needs to be some form of specific group dedicated to this issue. And so maybe there's a task or a task force or some sort of department, within, I don't know, the DEI office, student affairs office, whatever, that says specifically, we're going to go out and put forth our intentional efforts on maybe getting grant funding or unrestricted grants to recruit more Black men, starting at the elementary school level, not starting at the college level. And so I think what it comes down to is just being intentional, right? And so just having a group of people saying that, hey, okay, this is kind of our only job to do. Because if we go back to what the documentary says, and Dr. O he says that medical schools are kind of the gatekeepers, right? This kind of putting the accountability on them. And so I think there's some truth to that. And so just to, just kind of solidify that thought, it would just be really making a set aside department for this specific issue.
Excellent.
I think that, sorry.
Go ahead.
I think that whatever the solution is, I think that the efforts should be initiated early on in the process, meaning grabbing these guys in high school, being a young Black man growing up in a larger city, the pull to do different things, whether it be sports, whether it be something not in the medical field, that pull is strong. So capturing the attention of young Black men early on, and then encouraging them and to continue pursuing medicine, and motivating them, and again that mentoring piece coming in there early on, I think is one of the keys to kind of increasing that the amount of Black men applying later in the future. Again, because there's just a lot of distractions. Some men have to take on the role of the head of the household. Some people have to work as they get older. So a lot of things, there are a lot of distractions. So I think again, just capturing the attention and the interest early on will make a big difference as well.
Thank you, sir. So once again, just in closing, know that the biggest part of being represented and moving forward is just to be able to have future dialogue and future conversations and be able to pick the brains of people who are essentially in these positions to be able to move the narrative forward. What we have presented today is essentially a panel of experts, and they're experts on their own life and their narrative and experience. and what that brings to the table in terms of patient care, what that brings to the table in terms of new ideas, and just what that brings to the table in terms of making sure that we do what we took the oath to do. So thank you all so much for coming out and just being able to hear our voices and give us a time of day. As we move forward, I encourage each of you to jump into that documentary, listen to some of the stories that are heard, that this is not a problem specific to just Tulsa. This is a worldwide problem. And with that, we're excited to just have future conversations about what we can do moving forward. If you have any questions that didn't get answered today, or you'd like to talk further, please reach out to Brenda Davidson in our DEI office, which can get information out to us and we can speak to you directly. But with that, we will close. And if Brenda has anything else, thank you guys all so much for joining us today.
Thank you so much for joining this wonderful and very well-needed event. And if you need anything from the DEI office, we are here for you. And once again, thank you, student Dr. McNeil, Dr. Thomas, student Dr. Jackson, student Dr. Simon, Dr. Peter Okusawa, Dr. Yujiki Bailey. Thank you for student Dr. Carr. Thank you for taking the time out of your busy schedule to participate in this wonderful event. And most of all, thank all of you for attending.